I'm here today to tell you all about Profhilo because I get many questions asked about this, so I'll let you know a little bit more.
What is Profhilo?
So Profhilo is an injectable gel that consists of long chain and short chain hyaluronic acids. Effectively, hyaluronic acids are in our skin naturally and in a form of free-flowing hyaluronic acid, and it helps promote hydration of the skin.
How does it work?
So Profhilo works by us injecting this hyaluronic acid. It's a form of hyaluronic acid that's not a filler, so we're not getting volumization with Profhilo, but it's the free chain, long and short chain hyaluronic acid. When we inject it into the skin itself, it spreads very quickly within the skin, and it boosts that natural hyaluronic acid content of the skin. And as I said, hyaluronic acid promotes hydration. It allows water, it draws water into the tissues and specifically into the skin. So it's plumping the skin, it's improving the tone and the texture and the hydration of the skin. So some people say that it's an injectable moisturizer and very powerful in that sort of way. But we call them biostimulators or biorevitalizers. And that's the term that's often used for Profhilo itself.
How is Profhilo administered?
Profhilo is administered by some very simple injections into the skin itself, which sounds painful. So we actually use a topical local anesthetic cream to make it a pretty pain-free procedure. And we just, using a tiny needle, inject the Profhilo in the face specifically. We can just inject it in 5 key areas because Profhilo, once it's injected, spreads very, very quickly within the skin itself.
What age benefits the most from Profhilo?
So the age that tend to benefit the most from Profhilo, and it can be men or women, is when we're starting to lose the natural hyaluronic acid in our skin. So from an early age, from the mid-20s, we're tending to lose collagen and elastin. That's the structural protein components of our skin. And unfortunately, when we lose the collagen and elastin, we lose also the ability to produce and retain hyaluronic acid within the skin. So obviously, as we're getting older, we're gradually losing the amount of hyaluronic acid in the skin. And that might be first noticeable in your 30s or your 40s. And Profhilo can really boost the hyaluronic acid in those age groups. It can be used in older age groups, but because there's increasingly more collagen loss in those patients, then I find that other treatments that stimulate more profoundly the collagen production in the skin are going to give better results. But certainly in my experience, in your 30s and 40s, Profhilo is an excellent treatment for giving the skin a really quick boost. It works quickly, so people start to see improvements in the quality of the skin, the elasticity, the turgor, and just a sort of a boosting of the hydration of the skin. And that's seen very quickly within a matter of days and weeks following the Profhilo treatment.
Is the treatment painful?
As I said, the treatment can be painful if we just inject the skin without local anaesthetic. So at Skin Excellence clinics, we get you along 45 minutes or so before a treatment, and we use a topical anaesthetic. We have a very powerful topical anaesthetic which we place underneath a small cling film mask, and we find that for most people the treatment then is pretty much painless.
Are there any after effects?
So after a treatment with Profhilo, immediately afterwards, because we have to inject the Profhilo into the skin, there is a small bump in the area of injection. But I find that certainly in younger skins, those in the 30s and 40s, that little bump of Profhilo spreads within the skin very quickly, and within a matter of hours, and certainly within a day or two, there's no evidence of the Profhilo being injected. From that point of view, the little mini swelling or the mini bumps in the skin have disappeared. They're not usually itchy or red, and they can easily be covered with makeup.
How many treatments are needed?
So the number of treatments with Profhilo, what we tend to have as a protocol, we find that that usually 2 treatments fairly close together, maybe about a month or so apart, tends to really give the best results. And then they give a reasonably long-lasting result that usually lasts around about 6 months before you need retreatment.
What is the maintenance period?
A lot of our patients who see some very positive benefits from the treatment with Profhilo are keen to maintain the results without having to have more intensive treatment. So we usually find that every 4 or 6 months is a good period to have your Profhilo treatment, just a single treatment. In some patients it can last longer, and it may be once or twice a year that they need the Profhilo treatment.
Can the treatment be combined with other treatments?
Profhilo can be combined with other treatments, definitely, yes. It's a biorevitalizer of the skin, and it's supporting the hydration and the moisture content of the skin. It can be combined with other treatments that might be lifting the skin, like thread lifts or fillers perhaps, collagen stimulating treatments like elastin. It can be very useful to pre-treat the skin or to treat the skin when you're having energy-based treatments that are really remodeling and tightening the skin, such as Morpheus 8.
Which areas respond best to Profhilo?
So Profhilo can be used anywhere on the body, really, where we have skin, where we want to improve the hydration of the skin. So naturally, most of our treatments are on the face or the neck or the décolleté, but there is body Profhilo as well, where we can treat perhaps the thinning, sort of wrinkling, dehydrated skin, maybe the upper arms or the abdomen or around the knees, those sort of areas where that sort of is more noticeable, and it can be quite nice in those areas too.